How to shrink the prostate naturally. Prostate enlargement happens when an accumulation of androgens prevents prostatic cell death and promotes cell proliferation, increasing the size of the prostate gland. An enlarged prostate, or benign prostatic hyperplasia, can cause frustrating and uncomfortable symptoms, most commonly, urinary and sexual difficulties. However, several natural remedies and lifestyle changes can help ease the symptoms. Natural remedies for an enlarged prostate. The severity of a person's BPH symptoms will determine their treatment options. If the condition is negatively affecting the person's quality of life, doctors may prescribe medications, such as alpha blockers and 5-alpha reductase inhibitors, or even surgical intervention. Alpha blockers help reduce BPH symptoms by relaxing muscles in the urethra and the neck of the bladder, which can improve urine flow. The drug 5-alpha reductase converts testosterone into dihydrotestosterone. DHT is an androgen that prevents the death of prostate cells and promotes their proliferation. Through these effects, it increases the size of the prostate gland. Inhibiting the production of this androgen can help slow or stop prostate growth. However, some people may wish to try natural remedies for BPH. Those wishing to try these remedies should consult a doctor or an integrative medicine physician first, if possible. 1. Saw palmetto. Saw palmetto is a palm native to the southeastern United States. The extract of this plant is a popular herbal supplement for the treatment of BPH. 2. Ryegrass pollen. Ryegrass extract contains substances that can inhibit prostatic cell growth and reduce inflammation, according to older studies trusted source. In turn, this may help improve BPH symptoms, such as frequent urination and nocturia. 3. Stinging nettle. Stinging nettle contains similar antioxidant and anti-inflammatory compounds as pigum and saw palmetto. A 2019 review found that nettle root extracts can effectively reduce BPH symptoms and improve the overall quality of life of people with the condition. 4. Pigum africanum. Pigum africanum extract comes from the bark of the African plum tree. This extract offers many potential health benefits and contains a wide range of fatty acids, alcohols, and sterols, such as beta-sitosterol. These substances have an antioxidant and anti-inflammatory effect on the urogenital system. 5. Lycopene. Lycopene is a naturally occurring pigment present in many fruits and vegetables. A pilot study found that the daily consumption of lycopene-enriched extra virgin olive oil improved prostate health and reduced prostate-specific antigen levels. Tomatoes are the richest source of lycopene available to most people, but a few other fruits and vegetables contain lower levels of this antioxidant. Usually, the deeper the color of a pink or red fruit or vegetable, the higher its lycopene content. Other sources of lycopene include papaya, pink grapefruit, watermelon, guava, carrots, red bell peppers, apricots, red cabbage. 6. Green tea. Green tea contains high levels of antioxidants, some of which research has shown to enhance the immune system and potentially slow the growth of benign prostate cells. However, it is important to keep in mind that green tea contains caffeine. Caffeine can stimulate the bladder and cause a sudden urge to urinate, potentially worsening BPH symptoms. 7. Zinc. Taking zinc supplements or increasing the dietary intake of zinc can lower a person's risk of having a zinc deficiency. Zinc can also decrease the production of DHT and inhibit this androgen from binding to receptors, potentially reducing BPH symptoms. Poultry, seafood, and several seeds and nuts, such as sesame and pumpkin seeds, contain zinc. 8. Soy. Soy is an inhibitor of 5-alpha reductase and a low-potency estrogen. Soy may block the receptor sites that the stronger estrogens use to increase the accumulation of DHT. Beta-sitosterol is a major compound that occurs naturally in soy, An older clinical trial found that people with BPH who took a 20 mg trusted source dose of beta-cetosterol 3 times a day experienced an increase in urinary flow and a decrease in residual urine volume in the bladder. 9. Omega-3. A diet rich in omega-3 fatty acids can help reduce the action of compounds that play a role in prostate inflammation. Foods rich in omega-3 fatty acids include a trusted source cold water fish, such as salmon, mackerel, and sardines, as well as eggs, walnuts, and some vegetable oils. 10. Cranberry. Cranberries contain phytonutrients with anti-inflammatory properties. Risk factors for an enlarged prostate. Factors that can increase the risk of an enlarged prostate include age, diabetes, obesity, family history of BPH, heart disease. Most males have a 50% chance of having BPH by the age of 60 years and a 90% chance by the age of 85 years. Foods that may be beneficial for people with BPH include fiber-rich foods, such as whole grains, legumes, beans, and dark, leafy greens. Fruits and vegetables rich in antioxidants, which are usually dark red, yellow, or orange. Foods rich in zinc, such as eggs, most types of seafood, and nuts. Products that contain phytoestrogens, such as soy foods, chickpeas, alfalfa, and fava beans. Foods that people with BPH, or those at risk of developing it, should avoid or limit include caffeine, artificial sweeteners, alcohol, nicotine, carbonated drinks, starchy, refined foods, red meat. Making dietary changes may help people manage or prevent an enlarged prostate and any resulting symptoms.